Picture this. You've been feeling a little off for the past few weeks. Maybe your stomach has been acting up, maybe you've been more tired than usual, or maybe something just doesn't feel quite right. You tell yourself it's probably nothing. Just stress, just something you ate, just getting older. Most of the time you'd be right. But sometimes those small, easy-to-ignore signals are your body trying to tell you something important. Colon cancer is one of the most common cancers in the United States, and it's also one of the deadliest when it goes undetected. Here's the thing though, when it's caught early, the survival rate is remarkably high. The challenge is that the earliest signs are often quiet, subtle, easy to brush off. That's exactly why this conversation matters, because the difference between catching it early and catching it late often comes down to one thing: knowing what to look for. In the next few minutes, we're going to walk through 5 signs and symptoms of colon cancer that you should never ignore. Not to scare you, but to give you the kind of information that could one day make all the difference. Before we get into the signs, let's take a quick moment to understand what we're actually talking about. Your colon, also called the large intestine, is the final stretch of your digestive system. It's where your body absorbs water and prepares waste to leave the body. It's a hard-working organ, and most of the time it does its job quietly in the background. Colon cancer usually begins as something called a polyp, a small growth on the inner lining of the colon. Most polyps are harmless, but over time, certain types can slowly turn into cancer. We're talking years, sometimes a decade or more. That slow timeline is actually good news, because it means there's a wide window of opportunity to catch problems early. The tricky part? Colon cancer often develops without making much noise. You can have it for a long time before symptoms show up, and when they do appear, they tend to mimic everyday digestive issues, which is exactly why knowing the signs is so important. The first sign to pay attention to is a noticeable change in your bowel habits. And when I say change, I mean a real, lasting shift in what's normal for you. Now here's something worth understanding. There's no single definition of normal when it comes to bathroom habits. Some people go 3 times a day, others go 3 times a week. Both can be perfectly healthy. What matters isn't comparing yourself to someone else. It's noticing when your own pattern starts to change without a clear reason. So what kinds of changes are we talking about? Diarrhea that keeps coming back, constipation that won't go away, stools that suddenly look thinner or narrower than usual, sometimes described as pencil-shaped, a feeling that you can't fully empty your bowels even right after going, or alternating between diarrhea and constipation for weeks at a time. Why does this happen? When a tumor grows inside the colon, it can interfere with the normal flow of waste. It might narrow the passageway, irritate the lining, or disrupt how the muscles of the colon move things along. Your body responds by shifting its rhythm, and that shift is what you notice. Of course, plenty of everyday things can throw off your digestion. A change in diet, travel, stress, a round of antibiotics, a stomach bug. Most of the time, those changes resolve on their own within a few days or a week. The key word here is persistence. If a change in your bowel habit sticks around for more than 3 to 4 weeks, especially without an obvious cause, that's a signal worth taking seriously. Think about it this way. Imagine someone who's always been regular suddenly finds themselves going to the bathroom more often or struggling to go at all, and it just keeps happening week after week. That's not something to wait out indefinitely. That's something to bring up with a healthcare provider. The second sign is one that tends to catch people's attention right away: blood in the stool or rectal bleeding. And while it can be alarming to see, it's also one of the most important signals your body can send. Blood from the digestive tract can show up in different ways. Sometimes it's bright red, visible on the toilet paper or in the toilet bowl after a bowel movement. Other times it looks darker, a deep maroon, or even black and tar-like. That dark, sticky appearance usually means the blood has traveled further through the digestive system before leaving the body. There's also a third kind of bleeding that you can't see at all. It's called occult blood, and it's only detectable through a simple lab test. This hidden bleeding can go on for months without anyone noticing, which is part of why screening tests for colon cancer often check for tiny traces of blood in the stool. Here's the part where it's important to stay calm. Bleeding from the rectum is actually quite common, and most of the time it's caused by something completely benign. Hemorrhoids are by far the most frequent culprit. Small tears in the anal tissue, called fissures, can also cause bleeding, so can certain inflammatory conditions. But here's the catch. You can't tell just by looking. Blood from a hemorrhoid and blood from something more serious can look very similar. That's why any bleeding, even if you think you know the cause, deserves a conversation with a healthcare provider. A few patterns raise more concern than others. Blood that's mixed into the stool rather than just on its surface. Dark or tar-like stools. Bleeding that keeps happening over several weeks. Or bleeding combined with other symptoms like fatigue, weight loss, or changes in bowel habits. The takeaway is simple. Don't assume. Don't wait it out. Get it checked. Most of the time it's nothing serious. But if it is, catching it early changes everything. The third sign is persistent abdominal discomfort. And this one can be tricky because almost everyone deals with some kind of stomach issue from time to time. We're talking about things like cramping, bloating, gas that doesn't seem to go away, a feeling of fullness even when you haven't eaten much, or aching pain in the belly that lingers. Sometimes it's a dull, nagging discomfort. Other times it comes in sharper waves. It might show up after meals, or it might seem random. Why would the colon cause these kinds of feelings? When a tumor grows inside the intestine, it can partially block the normal movement of waste and gas. That blockage creates pressure. Pressure leads to bloating, cramping, and discomfort. In some cases, the tumor can also irritate the surrounding tissue or trigger inflammation, which adds to the pain. Now here's where it gets complicated. Lots of other conditions cause very similar feelings. Irritable bowel syndrome, food intolerances, acid reflux, a simple case of indigestion after a heavy meal. These are far more common than colon cancer, and they usually come and go. So what makes abdominal discomfort more concerning? A few things to watch for. Pain or bloating that's new and doesn't have an obvious explanation. Discomfort that keeps coming back or steadily gets worse over time. Symptoms that don't respond to the usual remedies. Changing your diet, cutting back on certain foods, taking over-the-counter products. And especially discomfort that's paired with any of the other signs we've talked about, like bleeding or changes in bowel habits. One helpful thing you can do is keep a simple log. Jot down when the discomfort happens, what it feels like, how long it lasts, and what you ate or did beforehand. That kind of record can be incredibly useful when you sit down with a healthcare provider because patterns that seem random in the moment often become clearer on paper. Now, before we move on to the next sign, I want to take a quick moment because if anything we've talked about so far sounds familiar, there's something you really need to see. A lot of the digestive issues we've covered, the bloating, the cramping, the feeling of never fully emptying, the irregular bowel habits, often share a hidden root cause that most people have never heard of. It's something that can quietly build up inside your intestines over years. Some experts estimate that up to 10 pounds of toxic waste can stay trapped inside the gut, slowing digestion, feeding inflammation, and leaving you feeling heavy, tired, and uncomfortable day after day. The good news? There's a simple, science-backed approach that thousands of people are now using to gently clear that buildup, restore healthy digestion, and start emptying their bowels up to twice as fast, without restrictive diets, expensive probiotics, or medications. It's based on an 8,000-year-old underwater gut superfood that's been used by more than 3 billion people around the world. And the most surprising part? It actually works even better when you eat fewer fibers, not more. I've put together a short video that walks you through exactly how it works and why it's helping so many men and women finally feel light, clean, and comfortable again. To watch it, just point your phone's camera at the QR code on the screen right now, and it'll take you straight there. If you're on a desktop or you can't scan it for any reason, The link is also pinned at the top of the comments below. Just tap it and you'll be redirected immediately. Go ahead and pause the video, take a quick look, and then come right back, because the next two signs we're going to cover are some of the most overlooked, and you don't want to miss them. All right, let's get back to it. The fourth sign on our list might surprise you, because at first glance, it doesn't seem to have anything to do with your digestive system at all. It's unexplained fatigue or weakness. We're not talking about the normal tiredness that comes from a busy week, a poor night's sleep, or a stressful stretch at work. We're talking about a deeper kind of exhaustion, the kind where you wake up tired, you stay tired through the day, and rest doesn't seem to fix it. Some people notice they get winded climbing a flight of stairs they used to take easily. Others feel weaker than usual, look paler than usual, or notice their heart racing during simple activities. So why would colon cancer cause this? It often comes down to slow, hidden bleeding. When there's a tumor in the colon, it can bleed in tiny amounts over a long period of time, amounts so small you'd never see them. But over weeks and months, that slow loss of blood depletes your body's iron stores. And without enough iron, your body can't produce enough healthy red blood cells to carry oxygen where it needs to go. That condition is called iron deficiency anemia, and the result is fatigue, weakness, and shortness of breath. What makes this sign particularly important is that for some people, it's the very first clue something is wrong, long before any digestive symptoms show up. The good news is that anemia is easy to detect. A simple blood test called a complete blood count can flag low iron levels. And if anemia shows up without an obvious cause, especially in adults over 45, it's a finding that deserves a closer look. The fifth sign is unintentional weight loss, and the word unintentional is doing a lot of work here, so let's break it down. If you've been working on losing weight, eating differently, exercising more, cutting back on certain foods, and the scale is going down, that's expected. That's not what we're talking about. What we're talking about is weight loss that happens without you trying. Pounds slipping away even though your diet, your routine, and your activity level haven't changed. A general rule that often gets used is losing around 10 pounds or more over the course of 6 months or so without a clear reason. Why does cancer cause weight loss? A few things are usually going on at once. Cancer cells use up a lot of the body's energy, even at rest. The disease can also trigger changes in metabolism that cause the body to burn through nutrients faster than usual. On top of that, appetite often drops. Food may feel less appealing, or a person may feel full quickly. Some people also experience subtle nausea or discomfort that makes eating less enjoyable. Of course, weight loss has many possible causes. Stress, thyroid issues, changes in medication, depression, and other health conditions can all play a role. So weight loss alone doesn't point to one specific problem. But here's the bottom line. If the pounds are dropping and you can't explain why, that's not something to wave off as a lucky break. It's a meaningful signal, one that's worth talking through with a healthcare provider sooner rather than later. So we've covered the 5 signs. Now the question is, what do you do with this information? The most important principle to remember is this. Persistence is the warning flag. A single bad day, a one-time bout of discomfort, a brief change in your routine, those things happen to everyone. But when a symptom sticks around for more than a few weeks, or when several of these signs show up together, that's when it's time to make an appointment. Here's something else worth knowing. You don't have to wait for symptoms to take action. Screening tests can detect colon cancer and even precancerous polyps long before anything feels wrong. A colonoscopy is the most well-known option, but there are also simpler at-home stool tests that can pick up hidden warning signs. In the United States, the general recommendation is to start regular screening at age 45 for people at average risk. If you have a family history of colon cancer, certain inherited conditions, or other risk factors, your healthcare provider may suggest starting earlier. That conversation alone is one of the most valuable things you can do for your long-term health. Here's the takeaway worth holding on to. Your body is always talking to you. The signs we've covered today aren't meant to cause worry. They're meant to give you the awareness to act early, ask questions, and have honest conversations about your health. Pay attention. Don't let embarrassment, fear, or busyness get in the way. A simple conversation with a healthcare provider could be the most important one you ever have.